Hey there, this is Dr. Mark Daly. Forgive this recording. I'm going to be in the room in just a few minutes to go over your x-rays. But before I do that, I really want to lay a foundation so you know what we're looking at. If you're watching this presentation, that means that it's been determined that you have some degree of spinal degeneration. And I want you to have a good idea what that means. So what you're looking at now is actually the progression of the degenerative process. If you look to the film at the far left, what you'll notice and what makes this normal is a good banana-shaped curve and good disc height. Now, you can understand this, so I just want to get your attention for a minute. So when we look at your x-ray, what we're going to ask ourselves is, do we have the proper banana-shaped curve? Do we have good disc height? And are the bones, the borders of the bones, well defined? So this is normal. Three things we're looking for: a good banana-shaped curve, good disc height, and well-defined borders on the bones. Now, the way it progresses normally is the first thing that happens is we lose the proper curve. You can see that there's not a banana-shaped curve here, yet the disc height is still pretty good. Over here, we see thinning of the disc, so it's gone to the point now that the discs are thin. And then here we have thinning discs and even calcium deposits. Those are known as spurs. Now, what happens when the neck has the proper curve, the bulk of the weight of your head is distributed back here on these joints called facets. Those are designed to bear the weight of your head in every step you take. When the curve is not proper, the bulk of the weight goes on the front of these joints or the vertebra, and then we see thinning of the disc and calcium deposits. This is known as cervical degeneration. So here again, here's an example. Here we have the proper curve. Look at that. Good banana-shaped curve. Good disc height between the bones. Here we literally have a reversal of the proper curve. So rather than bearing the weight of your head back here on these joints, it's actually pinching these vertebrae and they're starting to deform. You see the thinning of the disc there and the calcium deposits. So this is what we're going to be looking for when we view your x-ray. Structural misalignment. Any deviation from normal causes premature degeneration. Degenerative disc disease is a progressive condition that gets worse in time, not better. So it's a lot like the front end of the car. If the front end of your car is out of alignment, it wears the tires in places they weren't designed to wear. It's the same thing with your vertebral structure. So here we're looking at a good thick disc. That's what we want to see. Remember, between every vertebra, you have a disc and you have nerve roots that literally come off the spinal cord. As time goes on and as the structural misalignment causes premature wear and tear, we see thinning of the disc, calcium deposits, and then eventually it sits bone on bone. So the chances of impinging or pinching that nerve become greater and greater. Here we see a disc bulge. That's when the contents of the disc actually push the disc into the nerve root. The nerve root is over here. That causes a nerve impingement. Here we see a herniated disc where the contents of the disc are no longer contained within the disc itself and puts pressure on the nerve. Here we see thinning of the disc. That causes that hole to get smaller and increases the chances of having a pinched nerve. Bottom line is it causes neck pain or upper back pain, and that's why you're here today. For some of you, it's causing radiating pain. So not just pain in the neck, but pain that literally runs into the shoulder, the upper arm, the forearm, even numbness and tingling in the hands. For some, it causes pain inside that shoulder blade. That's called radiating or radicular pain. So it can not only cause pain, it can also cause postural deformities. These postural deformities, well, when they're advanced, they look a lot like this, and that is not what you want to look like. Now, this gal has got good posture. Look at that. Her ear lines up over her shoulder, over her hip, but as we see this degeneration progress, we see the hump here, and of course these people are just way advanced. Now, it is a progressive decline. So you start out looking like this. That looks good. Her posture's nice. Here we start to see slight deviation more and more as time goes. And here we see the hump again. You look even in a young lady like this, she's got the beginning of a hump. And then after correction, actually, we got rid of that hump. So you can see that's called Dowager's hump. Some of you have family members with that problem. Now, the interesting thing is, as the head moves forward, the average head weighs 12 pounds, but as it moves forward, you lose the mechanical advantage, and it actually weighs more, or at least it puts more pressure on the vertebral structures and the muscles. So it goes from 12 pounds in its actual weight to a perceived weight of 32 and 42 pounds. So for some of you, it's almost like someone's behind you pushing your head forward. That's why you have so much fatigue. So the good news is we can stop or slow the progression of the degenerative process, but it's a lot like putting braces on a kid's teeth. You put braces on teeth and you exert force over time, and even with big gaps or crooked teeth, over time we see correction. Do you recognize this fella here? He looks kind of goofy in that one. But anyway, we have a three-pronged approach to our corrections. They consist of the adjustments, exercises, and mechanical intervention. The adjustments many of you are familiar with, but we do those with our hands or with instruments. We try to be as gentle as possible to get the job done. We also use exercises which are specific to restore the proper curve. You see exercises to reduce the hump, to strengthen your back, and of course to reintroduce the curve. We also use mechanical devices like non-surgical spinal decompression over here, where we have a computerized pulley. We get you on the table. We gently hold your neck while we pull and relax, pull and relax. It's very subtle and very comfortable. And then another device that's designed to push the curve into your neck, which is called a posture pump. So you actually lay on this. There's a strap here holding your head down, and you gently pump like a blood pressure cuff, and it pushes the curve into your neck. Very, very effective, and we get one of those for you to take home as well. So what happens is, this is a before x-ray. Some of you will look like this. You should have the banana-shaped curve, but this person doesn't. This is a before, this is an after. So you can see how close to the proper curve we've gotten. Here's a before, here's an after, a before and an after. So we have some very successful techniques that we use to restore the proper curve. Now, what we do is we offer two kinds of care. We offer relief care and we offer corrective care. Relief care is designed to stop the pain and restore function. Corrective care is designed to stop the pain, restore function, but also to slow the progression of the degenerative process and to restore proper alignment. Now, I work for you. You're the one that makes the decision, the kind of care you get. The goal of relief care is getting you free from pain and functional. The goal of corrective care is so that you will actually have a before and an after x-ray. So I want to help you any way that I can. Of course, the choice is yours. I will see you in just a moment.